And the next keynote is the future of digital health. And this is going to sound very strange because why doing less delivers more? This is going to be presented by Jussi Määttä, who's the CEO of Buddy Healthcare, exploring how stripping back complexities and focusing on essential facilities can lead to a more effective and accessible digital health solution. So please put your hands together for Mr. Jussi Määttä.
Hello everyone, nice to be here. My name is Jussi Määttä. I'm CEO of Buddy Healthcare, and as told, telling a little bit about why doing less delivers more in digital health. First, a little bit about me. I'm not ambulance, helicopter pilot, professional snowboarder, or ice hockey coach. And the reason why I'm telling this is that my 10-year-old daughter told that in their class at school, a teacher has asked a couple of parents to tell about their professions and what they do on daily basis. And she asked me that, Dad, would you, well, and okay, I asked, okay, I can come, but what kind of people have you seen there? Yeah. Jenny's pilot, Jenny's father, he's a helicopter pilot, and Annie's father was a professional snowboarder. And then there was an ice hockey coach. And then they want me as a really boring CEO in digital health, tell what I'm doing. But you will hear that today. I have a master's degree in software engineering, been in digital health and telecoms for 20 years, based in Helsinki, Finland. I do lots of sports in addition to leading a software company. At Buddy Healthcare, we provide a care coordination platform to automate patient care processes from home to hospital and from hospital to back home. Majority of the pathways, or actually all the pathways, somehow relates to the secondary care. So when patient has got an indication, they will get our app, and in the app patients will get all the information, actions, questionnaires, follow-ups they need to take when navigating throughout the care process, from home to hospital and from hospital to back home. And at the same time, when patients use the app, we provide a dashboard for care personnel. And our task is to make it simple. To make it simple for nurses and doctors to care about patients. And what we provide is a dashboard where nurses can easily see which patients are compliant with the care pathways, which patients requires further attention. Like we show a green light if everything is okay. We raise a flag if there are any deviations that needs to be intervened. And finally, we provide lots of analytics for payers, healthcare systems regarding PROMs, PREMs, and quality of life. And our business is really provide a platform. What is actually protocol or process our customer hospitals follow, that's up to them. We of course configure the processes for them, but we don't force them to use any specific protocol. We are based in Finland, founded 8 years ago. We are market leader there, but in addition to that we have paying customers in 8 European countries, UK, Ireland, France, Italy, Germany, Estonia. And our strategy is to provide a scalable platform to cover, as we actually I mentioned in the morning, providing one platform that can be good enough for the whole hospital so that they don't need necessary indication or specialty for specific systems to digitalize their care processes. I will start with the number. 97% of the healthcare data goes unused every year in healthcare systems. And the amount of data healthcare systems collect each year is 50 petabytes. That is equivalent of 50 million gigabytes of data that hospitals and health systems collect on annual basis. And 97% of that is unused. That is huge amount of data. Of course we can say that yes, this data is there and it can be used later on, but I claim that that data won't ever be used. And if we get this data automatically, there's nothing wrong in collecting lots of data. But in many times, and in majority of the times, when hospitals collect data from the patients, it requires additional work from someone. It requires work from nurses, doctors, or patients. And that's why I want to talk today about why less is more. I think we all know this, the promise of digital health. The digital health streamlines workflows and reduces administrative burden. Digital health should actually make healthcare scalable. Healthcare systems and hospitals should be able to reach more patients with less resources with their innovative solutions. And in the end of the day, digital health should lead to data-driven care, using insights and data collected to improve patient outcomes, care patients, improve the quality of the care, and improve the health of the population. But then comes the reality of digital health, and that is what I have overseen during the last 8 years. First of all, there's a provider overload. Nurses and doctors, they have way too many tools, they have way too complex workflows, and they want to do the minimum to treat the patient well enough. They want to avoid installing new softwares, new systems, or giving new apps or sensors to the patients. And even if they would do so, patients are fatigued and they feel stressed and tired to collect excessive amount of data with multiple touch points. So actually to keep patients motivated in digital care, you have to be able to motivate them, you have to be able to collect the data, but you cannot do too much. Like I've seen too many times, especially in the research projects that we have done, that researchers come up with the great ideas that we want to collect this data, and then after 1 minute we provide an additional questionnaire and gamify that and collect that data and that data. And that may work in the research settings when patients are motivated, usually by money, to participate in the study. But when you are really treating patients in their daily life, they feel very fatigued of too many interactions. And then if we collect too much data, we will overwhelmed rather than actionable. And that's one of the keys. Data collected should be measurable and actionable. And that's why I want to say that in order to provide scalable and impactful digital healthcare, you need to minimize the complexity and focus on what truly matters. So why less is more? When deploying digital solutions, if you are able to really dig into the care processes, what nurses and doctors need to do in order to ensure best possible results for every single patient, you have to minimize their effort. That reduces burnout and inefficiency and frees the time to actually focus on the patient care. In addition to that, by streamlining the patient experience, you avoid overwhelming the patients and you improve patient satisfaction and adherence with the care plan. And this is one of my favorite statements, big data versus small data. There is a room in healthcare for the big data. Big data is for the population level care, where you want to find diseases, where you want to find on a population level correlations between disease or treatment methods. But when you are treating the patient, it's actually small data that matters. Small data drives actionable insights. It's easy to act on, and it's really focused and patient-specific. Small data is the data that you collect during the care from the patient in order to make the right decisions and provide the right care for the patient. So by focusing on simplicity, we empower both providers and patients to achieve better outcomes with less effort. And I'm going to talk about 2 examples that we have done to achieve better outcomes with less effort. First case, Tampere Heart Hospital is one of the leading heart hospitals in Europe. They deployed our care coordination software 2 years ago to automate follow-up with their coronary patients. And when they automated the care process, they implemented the app for patients, which provides care process to timely collect, not too often, every 3 months, blood pressure monitoring. Patient pressure measures the blood pressure at home with them existing devices, so it's not connected in the platform. They enter the values in our app. There is a risk factor assessment and quality of life questionnaires. And before they implemented our software, the process was that whenever a patient was discharged after coronary angiography, they went home. They measured the blood pressure. If the blood pressure went up, they called the primary care or healthcare station. They went to visit them, and that's what they do still. They have timely 3 months follow-ups, like laboratory follow-ups in the process. But previously, fewer than 50% of the patients adhere to prescribed LDL-lowering medications. And health system wasn't able to identify which patients may have a risk for a secondary event. And majority of the patients came back to hospital through ER, which was usually way too late, causing too many additional secondary events. And they were really costly because patients weren't in the right time at the right place. And after implementing this very streamlined care process, at the 3-year checkup we've seen 55 to 70% of the patients adhering to prescribed LDL lowering medications. So it's depending by about sex. 70% of women adhere with the medication and 55% of the men adhere with the medication. Patients using the app were 3 times more likely to achieve target LDL levels, and with those in the target range being 4 times less likely to experience a secondary event. And this led healthcare system saving costs by receiving timely alerts for patients at risk of secondary events. And these timely alerts actually enabled them to provide more instructions for the patient, motivating them by sending them a message that it's your good to actually continue reporting and answering these questionnaires. So there was a manual intervention if patients became unmotivated. But that was way more less than they did before. So patient received digital education, no need for phone calls, no need for primary care appointments. Provider had got recurring follow-up that they actually could invoice from the healthcare system, and value-based healthcare data collected from the patient automatically. And healthcare system got reduced secondary events, and each secondary events in the EU costs on average 41,000 euros and they got less trained in the primary care because coronary patients didn't interact with the primary care. They were in touch with the specialists of the heart hospital all the time. This was an example in cardiology. I have another different example from the UK. NHS Lanarkshire is the second biggest health board in Scotland. They implemented our software to digitize preoperative assessment. Previously, all the patients having a surgery had a face-to-face appointment with an anesthesiologist and nurse at hospital. During this appointment, they went through, patients returned 16 pages of questionnaires to this appointment. And during the appointment, patients went through, together with nurses and doctors, the whole list of the questionnaires. And the task of the anesthesiologist was to identify the risky patients who may have a risk for anesthesia, who may need additional attention before the anesthesia. That was very costly, of course. And when we implemented a digital process, that's a two-stage process. There's a pre-screening, during which patients answer a short question about their health status, going through, of course, weight, height, all the diseases that may have. Typically, people too much overweighted or having a cancer are identified as a risk patients in the beginning of the care. And during the pre-screening process, we flag the patients who may have like a primary risk for anesthesia, and those patients will be still sent to hospital to have a face-to-face appointment. But around 66% of the patients get green light from the first pre-screening, and then they have a secondary questionnaire also provided by the app that identifies the medium risk patients. So through RAC scoring, we prioritize patients for surgery based on the risk. And in early process, all these 16 sheets of paper, they were scanned and uploaded as a PDF into medical record system. That's a lot of data that no one can use. And now with the digital process, 22,000 patients that they operate annually, around 70% of them uses the app at the moment. Patients are fit and ready for the surgery. It saves lots of nursing time with mobile preoperative submissions, avoids lots of pre-surgery hospital visits, and also we are able to provide patients with a lower risk to fill gaps from the last-minute cancellations. And surgery cancellations are also a major challenge in the Western healthcare. Depending on the season and medical specialty, 5 to 15% of all the surgeries are cancelled for the reason or another, and there's a huge cost for that as well. So, doing less. There was a digital assessment, no need for physical appointments, quicker and more convenient process completed remotely. From provider side, less resources were needed, and there was an automated red, amber, green process to score patients prior to surgery. And healthcare system are able to fill empty surgery slot with the low-risk patients, and they get better value for the value-based care. This is my favorite case, an example of doing less. Because we started working with NHS Lanarkshire 3.5 years ago. And when we started, we, as we do always, wanted to bring our own expertise. How do you need to do less? And actually, hospital told us, you know, we have done this for ages. We have renewed our surgery, a preoperative process 20 years ago. That's all lean. We don't need to do anything for that. And you need to adhere with our existing process. And we told, You are a customer, you are paying, of course. If you want to do so, let's do it. And what we actually did in the beginning was that we implemented those 16 sheets of questionnaires in the mobile app. Patients didn't like it. Nurses didn't find the right answers. They didn't like to use that, and in the end of the day, nurses didn't want to give the system to anyone. It was there, but they said that that doesn't work. We tried to challenge them. Probably we need to adjust the process or shorten the questionnaires. And the feedback was immediate. No, questionnaires are correct. They are perfect. We've been using them from 20 years. They work. They have worked always. But we insisted that you need to change. In order to be successful in digital, you need to change something and do less. And finally, we were able to convince them to do less and actually think about how to treat patients in a digital era. So, as an overall benefits of doing less. For providers, it's increased efficiency, it's revenue from automation, and it's better outcomes. For patients, it's higher engagement and improved access to the care. And for healthcare systems or payers, it's all about scalability, providing digital health solutions at scale. And it's, in the end of the day, cost savings. An important thing in digital health is, does it move the needle? Like we usually say when we see the customers that some ones are really implementing digital solutions, and some customers are just shaking their hands and they are acting like they are digital hospitals. And in that case, when you just act that you are digital, it doesn't move the needle. By moving the needle, you have to be able to scale digital solutions in order to save time, reduce burnout, and ensure sustainability. You have to be able to engage patients and scale it throughout the system, starting from indication, going to medical specialty level, and then to the whole hospital. If it's only point of care solution or for the one indication, I guarantee that doesn't scale in the end of the day. Thank you.